These are disclosures. So when I think of dealing with complications, I think we all kind of go towards the the easier things to think about, right? You want to see these patients more. You want to, make sure you're documenting well. You want to reach out to mentors and to your fellow colleagues, those kind of things. But I really want to take this talk and use dealing with complications as a way to kind of zoom out at our own wellness as orthopedic surgeons. And I think if we look at our own wellness, how better we're prepared to deal with everything we have to deal with within our field, then we'll be able to take care of these difficult patients a lot better. So when I think of orthopedic wellness, I think about it through are we balancing or are we flowing through our job? What skills do we need to have? And a lot of those skills will be important for talking about how to deal with complications, and then what does it mean to be a high performer, and then what's the call to action. So first is balance versus flow. So when you think about balance, are you thinking about trying to hold things up on both sides or two different lives, or are you trying to kind of hold the burden, hold everything else on your own shoulders alone? And when you're trying to hold things and you're trying to balance, we think about this concept of flow, which is how hard or how heavy or how large is the burden that you're taking on, which could be, dealing with a difficult complication. And then what is your skill set, right? If you have if you're highly skilled and you're able to, really treat these patients, then no matter how hard the challenge is, you'll be able to come up to it. And being an early surgeon, your skill of taking care of difficult patients and dealing with complications is going to be low. And it's how can we kind of focus on some of these skills to balance the challenges of some of these type of patients. Some of the challenges too is not just with the patients and just in the operating room. It's, there's challenges in life, there's challenges in relationships, there's challenges with family. And we have a lot of these commitments, which also factor in for how well we're able to deal with our day-to-day jobs, especially when complications come up. I'm sure if you guys see a total ankle and you're staring at it, this is not going to go very well. And balancing those difficult complications with lots of exciting things that are happening in life is not always easy. So that's why I think, in both job and home, we need to kind of evaluate our commitments. In work, we actually do have a metric for this, right? We call those work RVUs, or our relative value units of maybe how difficult a procedure is or how long it takes. But what about the emotional side of our jobs, right? Is emotional things that come in from home, emotional things that happen with patients, and especially dealing with complications and difficult complications. The amount of emotional RVUs that those weigh on us is really, really high, and would be higher than any work RVU. And I think thinking about those emotional and work RVUs, filters into how challenging a situation can be, and it gets more complex when it involves both home and work. So how to deal with these large commitments and these high emotional and work RVUs is we really need skills. Right now, if you look at any NFL, NBA, any of the high performing athletes, they all have coaches, life coaches, mental coaches, fitness coaches that are teaching them skills that aren't related to the game. And they're on the sidelines, and this is something that we don't really have today in orthopedic surgery. The skill set, why is it important? Why do we need these emotional skills to deal with these emotional RVUs? Like we're talking about dealing with, difficult or complex or patients. The real truth and the sad truth is that we actually have the highest level of suicide amongst all surgical subspecialties from 2003 to 2017. We're 2 times more likely to be depressed, and 61% of orthopedic surgeons even meet the criteria for alcohol and drug abuse. It's interesting, when you think about us as orthopedic surgeons, we're a very unique self-selecting group, right? We are all perfectionists, right? No one that goes into orthopedics who's not a perfectionist. We like to see a problem, fix a problem, and do it perfectly. We have stressful jobs where there's high expectations of our outcomes, and we're so used to quick fixes. And I think, unfortunately, there really has been some poor socialization of how to deal with complications, instead of just pushing it down and do better the next time. Like, no, how do we really sit with these complications, sit with these patients, sit with what happened, and how can we just deal with the emotional stress that comes with it without trying to move past it? It's really against our true nature as orthopedic surgeons to sit in uncomfortability, to sit in emotional difficulty, and to really do some of this deep work that I think all of us can really do together better in order, again, to deal with complications. We want to just have a problem, fix it. Even when a complication happens, how can I get this done and quick and finished as soon as possible? And sometimes that's just not the case. And it really, dealing with some of these complications, it really affects all of us, right? And it can really affect us emotionally. You'll see it when you have less patience, decreased energy, questioning your self-worth, increasing overall anxiety, emotional exhaustion, less engaged with relationships. I think every single person on this call, especially the attendings, you have felt this before, and these really, really do come up and rear its ugly head, especially when you're dealing with a really difficult complication in a patient that you really care about. For me, this really hit home when I was a chief resident at North Shore LIJ in Long Island. My mentor, the reason why I went into total joint arthroplasty, Dr. Vijay Risquina, unfortunately took his own life, and he was an unbelievable guy, and it was a total shock to everybody. He was really the person that everybody went to. He was the practice that everybody wanted to have, and it's really scary when these things hit home, especially in the people that you would least expect it in. So since his passing, I've really kind of spent a lot of time thinking about this, not less about work RVUs, but starting to think more about these emotional RVUs, and really trying to start to build a skill set, just like we build skill sets in our orthopedic practice, like with different special techniques and minimally invasive and robotics and all these cool things that are starting, and we go to courses and we work really hard to build our orthopedic skills. But I think we're missing this other half of this orthopedic skill set, which is how to deal with emotional RVU. So I like to kind of just run through with you guys just candidly and very vulnerably, some skills and some things that I've kind of initiated, especially early into practice. Not to call myself a master at all. This is something that's still very difficult for me, and I think difficult for all of us dealing with bad complications. But to have this emotional RVU skill set, just like you do in the operating room, I think is crucial in order to start to deal with these appropriately. First is therapy. I think it is extremely important for orthopedic surgeons, for all of us to have a good therapist, whether you're working with them regularly or you have somebody that you can just call when you need it. This is a professional just like us, right? If someone's coming to you that needs an ankle replacement, like they need to go specifically to you, not a podiatrist, not somebody that doesn't know how to do it, right? And so, therapists just like us are specialized in helping to deal with some of these psychological stressors. And it's really important to, start to try to find somebody, ask friends and family who they've worked with. There's good websites you can go to to get referrals. Again, I think it's super important to really be working with somebody on a regular basis. It shouldn't be looked at as a stigma. It should really be looked at as you continuing to try to maintain your mental performance as best you can. Second would be a coach. This on the bottom right is Victoria Anderson. I've been working with her since my third year of residency, and we've been working together. We talk once a month, sometimes it's every other month, and it's really great to have a coach. Just like we were talking about with athletes, right? They have recovery coaches, nutrition coaches, like they have coaches for every single thing, and it's the reason why LeBron James is still dominating the NBA at age 40, right? Because he's had coaches helping every single aspect of his performance. And when you think about us, like we're high performing athletes, like how can we be doing our job day in and day out without having coaches who are unbiased, helping us stay accountable, watching out for our blind spots, and helping us, continue to strive ourselves to be high performers. Exercise, it's a simple thing, but really, I think all of us are, for the most part, tuned into this. Nobody has ever exercised and then and didn't enjoy doing it. It's such a great way to reground yourself, and to kind of reset your mindset, especially when you're going through difficult times and you really kind of just want to sit down and do nothing. Starting to get yourself moving again is really important. Mindfulness is kind of I think it's a little bit of like a cheeky word and people throw it around too much. For me, mindfulness is a set of practices that really do three things. And I kind of put them as like the three L's. So first is learn how you work, right? You need to kind of get more in tune with your own self-talk and understand, how you speak to yourself. Where are you supportive of yourself? Where are you shaming yourself, and starting to get more familiar with that voice. Then find your location of self. So as you learn to kind of hear your own voice and your inner voice more, and there's a lot of different voices you can hear, then you can really kind of locate yourself. Like, what space am I in? Am I depressed? Am I anxious? Am I excited? And once you kind of find yourself, then you can use your moral compass, right? The rules that you want to live by, the person that you want to be. Once you kind of hear your own thoughts, understand where you are, then you can kind of guide yourself to be in line with the person that you actually want to be externally. There's a lot of different ways to go about doing this. You can read a bunch of books. There's a lot of people that write about this kind of thing, and really by reading other people's work, it can kind of help put your own frame and perspective into place. Meditation, journaling, doing a weekly recap. There's a lot of different mindfulness tools you could be able to do. Next is really just connecting to what we do. I mean, I am super fortunate to have great colleagues and great co-fellows, and work really well within our subspecialty society, within AUKUS. I think maintaining these work relationships is really important. And as you guys come out of residency and start fellowship, having amazing co-fellows and really kind of bonding with other people who are the same year as you is really important, because you're going to be going through this stuff with them in the same timeline. And so it's really important to kind of build that network of people that are around your stage of the career. Another thing which I've started to do, and I call it ortho circles. Me and probably a group of seven other total joint replacement surgeons from around the country, every other month we'll have a Zoom call, where it's really just an open floor. It's a safe space for everybody to just talk about whatever you need to talk about, whether it's work related, home related, and to have other colleagues that kind of understand what you're going through, and to have this open space to just talk about whatever you need to, is really, therapeutic and really helpful to have that peer support. So, what do you do when you're not in this emotional flow, right? It's nice to have this toolkit, and you could do all these things, and you're going to be you're going to be basically the Buddha of orthopedic surgery, right? But that obviously in the real world doesn't actually happen. So, it's really important when to recognize when you're not in that flow state, right? When the commitments and the RVUs, emotional and work, are just building up, and you feel like you don't have the capacity or the skill to really do what you need to do. That's when you really need to recognize that, hey, I'm starting to go in this negative direction, and I need to do something about it, right? For me, what I do when that happens is I'll look at my calendar over the next 2 weeks, and I will start to reschedule non-essential things, non-essential meetings. I'll start to say no to people, and I'll ask, I'll even ask my partners for help, saying, hey, something came in, I'm really I don't have the capacity to do it this week. I really need some time to kind of recharge. And I promise that the next time something pops up, I'll be ready. I think that's being able to have those kind of candid conversations with your partners is not always available, but at least here in Denver, I really feel like I can do that, and I implore you guys to try to do that as well and set those relationships up in your practice, and then start to prioritize your emotional skill set, right? If you're feeling stuck, start to exercise, go for a run, start to meditate, start to communicate what you're feeling, what's going on with your spouse, with your friends. And then again, reconnect with your coach. If you have a therapist, like, it's time to jump back into therapy and maybe do it more often, and really just recognizing, when you're getting out of flow, and stopping it as soon as you can will kind of get you back into that flow state. And I think all of this leads to, us thinking about a high performance mindset. when you think of high performance, right, you think of things like Formula One, you think of orchestras, you think of the All Blacks, you think of the Navy SEALs, right? There's all these really great examples that we can learn from. And I think it's us moving from this alpha male, alpha female, perfectionist, efficiency at all costs to one that's of high performance leadership, of collaborative teams, of getting into this physical and emotional flow, and having great self and social connection. And I do think, if you're able to kind of move into this area of high performance, then dealing with complications is a necessary and important part of being a high performance surgeon. So my call to action from this talk is that that for orthopedic surgeons that it's really starting to be okay to not be okay, right? There's so many things that are in commitments that are kind of going down under the water for us. And it's okay to ask for help, to be vulnerable with colleagues, for us not to be perfect. Like complications are going to happen. If anybody tells you they have the lowest complication rate that's ever been, like that person is not being honest with themselves. And it's being proud of making a lot of these inner and interpersonal changes, so that externally we can be there more for our colleagues, for our families, and for our patients as well. No one's exempt from burnout or from the burden of these emotional issues. Emotional RVUs should be just as important as work RVUs, and building a skill set around those is really important. And I urge everybody to take the next step, right? Get help, self-explore, make it okay to start to do this self-work, and encourage all of our colleagues to do the same, because somebody's life may depend on it. Thank you, guys.
Thank you. That was really a great presentation, Dr. Gold. And
Yeah.
I know others probably have a lot to say about it. I've been in practice 32 years, and I think there is a paradigm shift. I think that the conversation of fellows, residents, doctors working 80 hours a week, not getting home to their kids and family, um, not being able to, express themselves, being a stick of dynamite, so to speak. Those are the days of the past. And it's nice to see that there's this paradigm shift, and it'll be better patient management and better outcomes for everybody. So thank you for sharing that.
Yeah, thanks.
Yeah, Peter, thanks so much. It was I think last summer or fall that we connected, and your article is fantastic. So we'll make sure that everyone on the call has a chance to read it, because that was really it's really a good read, and I think this was a very valuable presentation. I want to underscore the ortho community, like finding people, whether it's your practice partners or those you trained with or friends that you meet at meetings, like having that group that you can comfortably get together and just talk about whatever. Like, I thought you outlined that very well, Peter, and that's really critical. So for those, many on this call are either early in practice or in training. Just keep that in mind. Keep those connections, because this will happen. You will have complications. You will feel overwhelmed, and getting those resources in advance, I think is really critical to make sure that you can be at your best, and it doesn't go sideways. So I thought it was great, and the list of resources I thought was really really helpful. So thank you, Peter.
Yeah. Yeah, and I wasn't really, I wasn't thinking about all of this at the time, but when I was doing my fellowship interviews, and we're going all around and meeting everybody in person, it was right before the pandemic. I really kind of used that as an opportunity to meet as many other uh arthroplasty surgeons who were the same year as me, even if we didn't go to the same fellowship. And so I really kind of urge, especially the residents and people that are going to start going around for fellowship, anyone who's doing fellowship interviews soon, because it's a really great way to just really start to build that network of other friends and colleagues that are the same year as you. And we text each other all the time. What are you doing with this? How do you deal with that? So it's really important to kind of build that peer network of people around your same year.
Other questions or comments for Peter? All right. Thank you again for being on, man. Really, really appreciate it. Well, that looks like you may be heading to the OR, so we'll let you get your case going, and we're gonna initiate our indications conference. So thanks for being on. Really appreciate your time.